Namaste. Almost all of us has experienced at least one nosebleed. This nosebleed is epistaxis. Epistaxis is defined as bleeding from inside the nose. It occurs in all age groups and often presents as an emergency. To treat epistaxis, it becomes very important for us to understand and locate the site of epistaxis. For this, we read the classification. Epistaxis can be classified into anterior epistaxis and posterior epistaxis. In anterior epistaxis, if the patient is sitting upright, the blood will flow from the front of the nose, whereas in posterior epistaxis, the blood will trickle down through the back of the throat. After trickling down the throat, the blood may be swallowed by the patient. After swallowing later, it may present as coffee-colored vomitus. And we see coffee-colored vomitus in hematemesis. Therefore, this becomes a differential. Then let's look at the table. Anterior epistaxis is more common and posterior epistaxis is less common. The site of anterior epistaxis is mostly Little's area or the anterior part of the lateral wall, whereas for posterior bleeds, we see them most commonly in posterior superior part of the nasal cavity, and these bleeds are often difficult to localize. Also, the posterior involves deeper vessels. Looking at the age, anterior bleeds are mostly seen in children and young adults, whereas posterior bleeds are seen in people with more than 40 years of age. Now you can connect the dots yourself that anterior epistaxis mostly occurs in children and it is also in the anterior part of the nasal cavity. So the cause will mostly be nose picking or trauma. Similarly, in posterior epistaxis, it occurs mostly in elderly and they have spontaneous causes, such as the most important one, that is hypertension and then atherosclerosis. Bleeding in anterior epistaxis is usually mild and the specific treatment is anterior packing. Before that, we can also apply local pressure. In posterior epistaxis, the bleeding is severe because it is due to deeper vessels, as I told earlier, and so hospitalization is required. Here we do posterior packing. Thank you. You can get the notes in the comment section, and I've already made a video on Little's area. Do watch it. Thank you.